Okay, next part is just your Venepuncture within the department. We have three devices we can actually use. We've got the bespoke, which is what's normally recommended, is the vac container, needle and syringe, and also butterfly. I say normally, wherever possible, this is the safest, easiest way of obtaining bloods, which is your normal vac container. Next on the line, if you've got veins that aren't sort of like too strong, you think they may collapse due to the actual vac containers itself, the actual tubes, then go for a needle and syringe. This way you get more control, and it's just a better way of doing it. And sort of like, we can use this on with cannulas as well. So if you cannulate the patient and you think that the actual vacuum bottles may collapse, put the syringe on the end and actually withdraw it that way. Once you've safely withdrew the blood, get rid of your needle, then for a safe way of decanting, we use these models, which are a vac container with a pink end on, and basically once you've done the bloods, move over and decant safely. The old way used to be the needle was on the end and you'd pop it into the end of the actual bottle. Very unsafe, high risk of needle stick injuries, and very fraught upon at the present moment. Next in line are butterflies. Some people like them. Personally, if you need a butterfly within the department, the patient really needs to be quite difficult, and if you're going to use one of these, then I would really look at actually putting a syringe on the end to decant your blood, and not a vac container, because if you need one of these, the veins are going to be weak and there's a high likelihood they will collapse. But you can actually put your vac container adapter on the end and use vac containers, but I would strongly recommend that if you're going to use one of these, then the veins are weak, they are small, then there's a high likelihood that they will collapse. Like with anything we're going to do, always gain permission off the patient. We need consent, otherwise it's assault, like we've mentioned before. Make sure it's the patient we are requiring to bleed. We've got the blood forms, we've checked date of birth, and they are happy for us to take the bloods. We apply our tourniquet. Where this is concerned, we're looking for veins that are quite large and easy to. The ACF is normally the primary place we go for, the easy. But remember, we only go inserting the needle slightly just to get the bloods. So I found where I want to go. We're going to clean the area. Got my vac container. I'm applying some pressure to the skin to hold the veins in line. I'm in. With these we get a flashback around the end of the needle. Taking my bottle and pressing. Why I'm doing this, I'm securing this nice and firmly. One of the biggest risks with the actual vac containers is actually when we're applying the bottle is either advancing it completely through, which can blow the vein, or when we go to remove it, pulling the vein out. So it's crucial that you hold that nice and firm. Took us bloods, inverted a few times to mix. On this one we've only just got 2 bottles, which is just the normal standard route. Tourniquet off. Got my gauze. Now I'm just placing the gauze slightly over and not pressing down. If you press down while you're removing the actual needle, there's a possibility you have actually cut or split the vein because of the pressure it's on it due to the bevel. So just rest it above, needle out, press, and then as soon as you're out, make your needle safe by putting your safety device over. applying some pressure to there, or if the patient's able to, get them to apply some pressure directly onto the site where you've done your venipuncture. And obviously take into consideration, if the patient is on warfarin or any blood thinners, they may bleed a little bit longer than normal. I would tend to put some tape over just to secure it in place. Obviously after we've done that, we're going to label the bloods up, send the bloods. Hold on.